After many requests, I've decided to re-upload Rich Piana's Autopsy video that I did about a year ago. This video is always timely. Obviously, still people are doing steroids, and I do see that people are getting hurt, so I decided to put this back up on the internet. And this brief introduction is to tell people to be careful. If you're on steroids, please see doctors. Please consider getting off steroids. I'd love to help you assess your health if you're on steroids and to see if we can get you safely off steroids. Thank you so much.
All right, so Doc, welcome. I just want to touch on, Rich Piana is back in the news. I know his autopsy, it just came out. Louis Marco actually posted a video last night. Shout out to Louis Marco for posting that video. He kind of touched on all the things that, the autopsy had been posted on about Rich Piana. What are your thoughts, Doc? Give the viewers a walkthrough, Doc, of the autopsy and kind of the cause of death and just the general kind of the whole autopsy, if you want to get right into it.
So this is going to be an evidence-based review. Obviously, I'm a medical internist. I'm a board-certified internist. We want to go through this in stepwise. Conclude on Rich and let him rest in peace, obviously, because I knew Rich. He was a great guy, and this is unfortunate that anyone's has died. So let's take it with the autopsy report right in front of me. Autopsy report, Rich Piana, date of death, August 25th, 2017. This report is dated October 30th, so quite a delay. And again, there's some politics in that. But let's get down to the bottom line here. Autopsy findings is what we find. It's cardiomegaly, so he's got a hugely enlarged heart, double the size of a standard person's heart. He has bronchopneumonia with bilateral purulent pleural effusion, so at that time. He's got ascites, brain edema, ischemic necrosis. He's got discoloration of the skin and the sclera, no recent significant injuries. We have no injuries, and no hospitalization specimen available for toxicology. That's the bottom line. That's what it says on the findings. Then, of course, we have all the details underneath. Let me lay out what happened. Here's what we know going back. Rich Piana, on the day that he entered the hospital and EMS was called, was apparently feeling well, was with his girlfriend, and was getting his hair cut in the bathroom. He had a loss of consciousness, which is called syncope. He had a syncopal event, which means his eyes rolled up and he went down, and that's all we know. At that time, then you think, why did he have that? What's the cause of a syncopal event? It's either respiratory failure or an arrhythmia, cardiac. Okay, and so the arrhythmia could be either from amphetamines, I see it, and the respiratory failure from narcotics or drugs, could be from drugs. And in the end of the day, Rich hit the ground, and at that point of time, his heart was either not beating, or he was in a dangerous rhythm that I'll discuss here in a minute that I think he had, it's common, or he was in respiratory failure, was not breathing. So it's heart or lungs, it's very straightforward. At that time, we know sooner or later, within minutes, Rich was not breathing and his heart was not pumping. And this is, I would assume, being supported by the girlfriend's testimony of what she was providing for life support. She was doing the compressions and doing CPR. And then it's supportive by the paramedics' findings. Without a heartbeat, without breathing for at least 10 minutes, I think maybe 20 minutes. So that's called anoxic brain injury. And that's actually supported on the clinical autopsy findings of his brain in the end. But then I will say that after 18 days in the hospital, a lot of the autopsy findings are, I'm not saying they're useless, and there are some things that are very relevant here that I'm going to go back on for the mechanism of action for how he died. But they're colors of the organs and things, those are useless. You're 18 days in ending up septic in the hospital for 18 days and having multi-system organ failures and then dying from what is a pneumonia. Okay, septic and pneumonia. Bottom line, that's what happened to Rich.
So Doc, I want to touch on why he syncopized. Why did he pass out? Why did he go down? You said it was either arrhythmia or respiratory. Could you touch a little bit on that?
Yeah. So again, let's go back. He syncopized. He dropped to the ground rapidly. He wasn't in bed sleeping and they just found him. He dropped then. What happened? Why did he drop to the ground and lose consciousness? And he hit his head, but that's incidental because on the autopsy findings, he had no trauma and no broken cranium. The brain findings are consistent with severe anoxic brain injury from what happened in the field from that 18 days before the day he died. He died in the field. Rich died. His heart stopped. Now, I'll tell you why. I'll tell you what's going on here. Rich dropped. He had a dangerous arrhythmia called VFib, ventricular fibrillation. Now, that's a dangerous rhythm that your heart ventricles are beating so fast and it's chaotic, it's not organized, and you're unable to produce cardiac output. So within seconds of that happening, you lose consciousness and you fall. And your heart's either restoring its own rhythm by itself, or a precardial thump, or electricity. Now, the paramedics came and they did restore his heart rate. That's guaranteed. He brought him back to life. It's incredible what they did. Too late. Rich died, and he was not able to pump blood to his brain, causing what we see on this finding, anoxic brain injury. But imagine it was either amphetamines, and we're going to get the real bottom line is his heart. It's heart. It's a multifactorial condition I'm going to lay out for you, which my suspicion of what actually happened is. Rich may or may not have done some cocaine, snorted his own pre-workout, snorted some oxys, took oxys, and so on and so forth. Probably not narcotics. Narcotics, you don't syncopize. Of course you can, directly from narcotics. You of course, if you're injecting a ton of narcotics with fentanyl, you will syncopize, but you're probably already laid down in bed or a chair or on the ground, okay? Rich rolled back, eyes rolled back. The girlfriend said that. So that's going to be such a rapid cutoff to blood supply to the head because of heart rate. So he went into a dangerous rhythm. So my side is an arrhythmia. It's VFib, VTAC and VFib. Okay, it's just what it is.
From what I'm gathering, it's definitely not it's definitely not lungs. It's definitely heart.
The lungs killed him in the end because he went through a decline over 18 days and he was septic, and in the end, he succumbed to a hospital-acquired pneumonia. They let him go. They made him comfortable, I'm sure, at that point. I'm sure he was septic, and I'm sure his blood pressures were in the tank, and they made decisions that then he starts having multisystem organ failure. And those are the findings you see, the congestion in the kidney in the liver, and the small amount of ascites. That's a transudative fluid that's in the abdominal cavity. It's nonspecific. I believe he has an arrhythmia. Now, let's talk about the mechanisms that I love. This is so cerebral for me, for an expert to put together. And again, we're just putting these together based on knowing what happens commonly and as much data that we have. And there's some data we don't have. We don't have tox report. We don't know if it was cocaine, amphetamines, narcotics, alcohol. We just don't know. So I'll bet you none of that played a role. Rich had a massively enlarged heart. Let's talk about the data now that we know. He had cardiomegaly. His heart was 670 grams. The average heart is about 300. So Rich's heart was twice the size. And I think for the data, Rich explained in the last couple months or a year, he had a large heart and he was working on that stuff. And so steroid users, growth hormone use, insulin, so on and so forth, being a big man, just by being 300 pounds, his heart's proportionally going to enlarge. We're not going to implicate steroids just yet. It's a multifactorial process. So Rich has an enlarged heart. He may or may not does drugs, the amphetamines. I would say cocaine, amphetamines. You can get vasospasm of the coronary artery, which could lead to a myocardial infarction, either transiently, or he had a blocked heart, which the data shows that he didn't have coronary artery disease. This is scientific now. Rich didn't have a heart attack, folks. He did not have a myocardial infarction. Why? Because on the evidence, on the autopsy, he had no scarring. He had no necrosis. He had a massively enlarged heart, but his coronary arteries interestingly enough, he had mild coronary artery disease. Mild. Not enough occlusion and blockage to cause an acute thrombus, probably, and therefore myocardial infarction. But this is what I see for steroid users when they have bypass surgery and stents placed if they have a heart attack. Rich didn't have a heart attack. Rich had an arrhythmia.
So Tom, in lamest terms, he didn't have enough plaque in his arteries to cause a heart attack.
No. Pretty good genes, because for a 46-year-old man, the way he was living with the steroids, pretty damn good genes. This is science, though, folks. He didn't have coronary artery disease significant. He didn't have a heart attack. He did succumb to his heart, though. He had an arrhythmia. Let's talk about the arrhythmia, okay? He had an arrhythmia which is called ventricular fibrillation. Common things are common. As a matter of fact, if you look for the data for people that collapse in the field, outside the hospital, before the hospital, up to 85% of them have a rhythm called VFib. Okay, what causes VFib? The majority of VFib is caused by coronary artery disease. Rich didn't have coronary artery disease, not enough to cause VFib. The next would be congenital heart disease. There's congenital abnormalities in the electrical system, not to mention the enlarged septums and so on and so forth, that can cause it. Rich had an enlarged heart massively. He had cardiomyopathy. Here's what I think happened. His heart was globally enlarged. They didn't do biopsies of the heart muscle. They didn't talk about it. They talked, this is an autopsy. They don't do that. It wasn't done. That moons lined up. He might have tipped it off with some snorting, some pre-training stuff that he does, or some cocaine or amphetamine. It doesn't even matter. The moons lined up. He dropped into a dangerous arrhythmia called VFib. No question. He was on the ground. He was in VFib. His heart wasn't connecting. It wasn't going back into sinus rhythm. They tried, the girlfriend, God bless her, she tried to do what a first responder would do without having technology and ACLS protocol. And she called 911. They came, I don't know, Matt, they came 15, 20 minutes.
Probably too late.
He was dead. Rich entered the hospital with severe anoxic brain injury. It says it right here. It's just necrotic. He had brain injury. But he didn't die from a blood clot in his head. He didn't die from a blood clot in his lungs. That's a pulmonary embolism. It's interesting that PMMA and synthol and some of these injectable oils can actually break off, and you can get oil embolus and what looks like a pulmonary emboli. But he didn't die from that, because that would be something they'd pick up right then and there in the ER, in the acute workup. So he's put in a medically induced coma, of course, and they stabilize his heart, and he is waiting, and his brain was very damaged. And I'm sure at a point with the family over this period of time, they made decisions to make him comfortable, and they held life support, and he moved on. And in the end, the absolute reason for death is sepsis, and that's evident by the bilateral pneumonia. He had a purulent pleural effusion, so he had a pneumonia. But that's the end. That's why they say that's not the cause of death.
That was just the reason that they pulled the plug.
That's right. Well, he's septic in the end. He died. The multi-system organ failure, sepsis. So the reason for Rich's death is an arrhythmia, superimposed secondary to a massively enlarged heart and decompensated state, and it's multifactorial. The drugs play a role. The steroids played a role because they enlarged his heart over years. They did not cause coronary disease. But I see mainly steroids causing coronary disease, and I see anabolic steroids causing enlarged hearts. The literature is supportive of this. I want to help men that are on steroids, that can come for help. If you're on steroids, please come to me. Reach out. I will help you. I will not discriminate. I understand what you're doing, and I want to evaluate you and care for you and provide you with data. How large is your heart? What do your arteries look like? Your labs, your CBC, your red blood cells. No, everyone gets all caught up in all these details, but I do it as a medical expert. It's my day job. Dr. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button, and please subscribe to our channel. And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.